As we talk about gastrointestinal diseases and talk about the microbiome and probiotics, you can appreciate that there is a meshing of terms and concepts. So you have seen that so far? Yes. You have seen that we can't talk about one and not mention the other. It's always interesting when you deal with technology. But you would have seen a version of this quotation somewhere before in previous presentations. I know you don't need to go over it, but truly, death sits in our bowels, right? We are home to a wide range, or should I say a wide array of organisms, as we would have encountered before this morning, that we are not alone, that every time we sit, wake, and sleep, we have company. And it's not just our children or our family members, so we ever have company. And it's not a small amount. It was truly amazing and eye-opening to realize just how much company we actually have. So in my time with you today, I will be touching briefly on a few things. So I want to be looking at I'm focusing mainly on probiotics. So I'm going to be looking at the probiotics that we use in some of our common gastrointestinal disorders. So that will be my narrow focus. I want to look at how these probiotics actually work and to really look at what evidence is actually out there, because we are in a unique position where we are, Doc said this morning, we are the gatekeepers, which is true. We are also the persons who see patients the most. Do we appreciate that? It's not just 12 times a year we see some patients, we see them every week. We have those patients, right, that show up every week, and when they don't show up, they call in to ask opinion and advice. So we must be in a position where we can truly advise as to what patients are to do when they come to us with these questions. So I'll be looking at the evidence, and of course, we need to know where we are going forward. So Doc this morning mentioned the history of probiotics. I don't need to go there, but that man really is considered, Michnikov is really considered the father of everything. As they tried to answer some questions based on observations that they made about how people were living well and doing well despite the fact that they were in less than desirable circumstances or socioeconomic standing. So they were doing better than their counterparts who were considered more well off. Right? So people started to evaluate the sour milk, right? And fermentation. So we're coming from there to where we are now. So as we have moved forward, we realize that there has really been an explosion of knowledge. So we have hit the 2000s, and certainly people have been conducting research from long before the 2000s. But when we hit the 2000s, we find that it really has been an explosion. So many things are now coming to the fore, and different things that we know really want to answer. It is in the 2000s that a lot of the clinical trials and studies were designed and developed and begun to look into the whole matter of probiotics and how they work. It is also really in the 2000s that people started to break down these bacteria and really look at them. Doc mentioned that there are quite a bit of organisms in our bodies, many we have not yet identified. Numerous that belong to the same species in and of itself. And so we are doing a breakdown of all of those things just to try to elucidate and to see what they are. And we have certainly also begun to delve into the concept of probiotics versus live cultures. So Doc mentioned that probiotics are live cultures, right? But not every live culture is a probiotic, right? We can appreciate that? Yes? So a probiotic must be live. We're not consuming dead bacteria. Dead bacteria confers no benefit to me. But if that organism is going to confer some benefit to me, some health benefit, then it now becomes a probiotic. We are aware that we have a range of organisms that live among us. And so we're not even going into that into much detail. But our probiotics are believed to work in a number of ways. And it's sort of numerous to count. Numerous is a lot to go into in terms of what people are now beginning to understand about these organisms that live among us that we are now utilizing for their health benefit. So probiotics are believed to modify our immunity. And when we talk about other things such as cancer cancer management, oncology, and some of our immune-mediated disorders, we now can begin to sort of appreciate the relevance of these organisms. Probiotics are responsible for displacing anybody that they don't like. So when they come to visit and they don't like you, they kick you out. So probiotics do that. In doing so, they alter the flora. They are responsible for enhancing or changing how the epithelial cells in our body functions. And they're also responsible by virtue of some of the compounds that they produce by altering the environment, right? This is just a little representation that summarizes some of the things that they do in terms of inhibiting the growth of pathogens. Their influence on inflammation is particularly important, and cell destruction, and how they work just generally in terms of antagonizing the growth of organisms. And this slide pretty much says the same thing. Now, these are just some of the common probiotics, and when I say common, I mean common, right? Because there are quite a lot. And the probiotics that we generally encounter or utilize in medicine generally belong to one of these strains or genuses, right? So it's E. coli, Lactobacillus, the Bifidobacterium, and the last one down the bottom. Those are the main three, but there are several others that we will see as we go through, right? And these are just some of the different strains that we will see and that we would have seen. Some of these may be here, some of these products may not be here, but these are some of the common probiotics or formulations that we generally would find. Certainly a lot of them are available in the US. Activa, or Activia should I say, is very, very common. You have heard of Activia? So everybody know Activia. Activia boasts themselves of being very, very special. Forgive me for using the trade name, because it consists of more than one probiotic. It is a blend, and one of the strains is considered exclusive to that particular product because it's specially engineered. And we're in an era now where that's where we're going. We're going into cosmetic medicine. We know about cosmetic medicine? Yes? We don't know cosmetic medicine? Like the makeup? Nobody's ever heard of cosmetic medicine? We, just like how we tailor make different things to suit our purpose, we tailor make our garments, our makeup is specifically designed and suited just for us or just what I would want. We're going into an era of tailor making medicines to suit the particular individual, and probiotics are no different. So we're entering into that era where medicines are tailor-made. So Activia has a tailor-made formulation of the Bifidobacterium that is unique, and also different strains of the Lactobacillus that they say also enables it to work really well. But there are particular properties that probiotics are required to have in order for it to be considered a probiotic. So not everything can just be considered a probiotic. For something to be considered a probiotic, you must know exactly what it is. It cannot just be Lactobacillus. You must know the genus, the species, and the strain. It's not just Escherichia E. coli. That can't just be it, because there are different strains of E. coli. Each one is different, and the function of each is different, which is what makes the conversation of do probiotics really work and their efficacy far more challenging because of just the vast story and the vast number of them. We can appreciate that for something to be a probiotic, that it must be safe, right? Because we don't want to take anything that's not safe for consumption. We can also appreciate that it must not be pathogenic, because we are consuming a bacteria, so we don't want to take anything that is now going to cause an ensuing infection. So that has to be an important property. It must be something that when it's consumed, it's not going to degrade in the body. It must be able to survive in that intestinal environment in which we're taking it. And of course, it must be something that's going to be stable and that is going to stay in that environment. And of course, there must be some kind of evidence surrounding the probiotic that will say that, yes, this thing really can confer a benefit to the host or to the person that is taking it. So we're going to spend a little time talking about what those possible benefits are. Now, in terms of the benefit of a probiotic, as we can appreciate, it's going to be very, very dependent on what probiotic you're talking about in the first place. It's going to be dependent on the dose. And as Doc would have said, there are so many questions about what is really the right dose. Because you heard the questions about how many spores you have in the Enterogermina, because it is really important how many spores you actually consume as to the efficacy, just like you would know a certain dose of a particular drug is going to be subtherapeutic. It's the same thing with a probiotic. And of course, it's going to be relative to the condition that you're treating the patient for. The duration of the treatment, of course, is important, just like with anything else. You're treating a patient for Helicobacter pylori, you know that 5 days is not going to cut it, right? It's the same thing with a probiotic. 5 days is not going to cut it for a lot of things. So duration of therapy is important. And we have to mention that there are inconsistencies. While there are studies, the further we go, the balance tips this way, then it rocks back that way, and sometimes you're not really sure where you lie. But the evidence does tend to err on the side that the higher the concentration is, then the better it is, or the more effective it is going to be for you. We have to consider how probiotics are going to be delivered, the mode of delivery. We have to consider the patient, because each patient is going to be different in terms of whether you're talking about a baby, an elderly person, and the disease conditions that that person may have, because that is going to alter how that patient is going to respond. And the major issue causing some confusion is that there are lack of clear guidelines and directives coming from any established body that would say, this is what this organization has to say about the matter. That seems to be a little bit deficient going forward. And so we want to be able to address those things. In the US, probiotics are regulated in basically two main ways. So it depends on whether it is considered a dietary supplement, then it is regulated under that auspices. If there are therapeutic claims, then you would have to do an investigational new drug application. So you will have to follow the pathway that you would have to follow for any drug that is being considered. But because a lot of probiotics don't follow that pathway, they are considered as supplements. You can appreciate that they are not so strictly regulated. So some persons may have concern regarding the standards under which they are produced, the standards from one probiotic to the next. And so that even plays a factor when we are talking about the studies that we do and we are comparing one probiotic to the next. Because if standards are missing, then the basis of comparison tends to be a little shifty. You don't know if you're comparing OTE apple and American apple, because the two of them name apple, but it's really not the same apple. Just like how we have different strains of banana, we really don't, there's a lot of inconsistencies there. But in Jamaica, probiotics, as you would have guessed, are also regulated here, but they fall under same two general arms in terms of how they are regulated. They're either treated as supplements, in which case the company cannot be making any claims to say this drug will treat this. If the company says this drug treat this, that's a therapeutic claim that must be substantiated, must go through the rigors of the Ministry of Health to be verified, and it cannot be now a list 1 or a list 2, right? It must fall somewhere high up the chain. And of course, as I said before, we have safety concerns with our probiotics. But the thing about probiotics, why a lot of us feel comfortable using them, is because they have been used relatively safely for centuries. People have been using probiotics, whether in the commercial sense of how we buy them in the pharmacy or from the age of people consuming sour milk, right? And other fermented products, when at the time we did not understand what it was in them that was actually beneficial to the patient. However, as with anything else, there can be side effects, right? Everything has side effects? Yes? Have you ever seen a patient with Stevens-Johnson syndrome? I've seen one, and he wasn't taking anything. It was some cream. He wasn't consuming anything, just a cream. Do you know that Panadol can cause Stevens-Johnson syndrome? Extremely rare. So just with anything, there are rare side effects. Sepsis has occurred in some patients, endocarditis in some patients, systemic infections in some patients, but it is rare. What are some of the things that you would want to maybe think about as to how likely some of these things are with our patients? It would be a factor of examining who your patient is. if a patient is immunocompromised, then that is always going to be a red flag. So you have to look out for those patients because they are more susceptible. Am I saying that all immunocompromised patients are going to get up and take something? No, I'm not saying that. The problem is we don't know. So that means we have to be extremely careful of who you recommend products to and be able to identify our patients who are immunocompromised, not just by the fact of the conditions they may have, like some of our diabetes patients, some of our thyroid patients, for example, would be considered immunocompromised. But some patients, they're taking medications that are going to alter their immunity and ability to respond. So we need to be able to look at all of that in order to assess our patients and make the appropriate recommendations. Now, we mentioned H. pylori before. Helicobacter pylori is an organism really that exists everywhere. It is found in quite a number of places, but it is really not supposed to be found in the stomach. But unfortunately, sometimes it finds itself there. We know Helicobacter pylori as a well-documented cause of peptic ulcer disease. Difficult sometimes to get rid of if you are not addressing it properly. Very, very difficult. The treatment guidelines for PUD, for H. pylori, has changed in the last 2 years. So there are some slightly different recommendations, but the standard of triple therapy still holds as being what is generally considered recommended our first line, but there are now different options available to our patients depending on what they were exposed to before, and these are generally considered to be fairly effective. Now, in terms of studies that have been done so far looking at H. pylori, the Bifidobacterium is one of the organisms that has been largely studied, and it has been looking at, studies have looked at how this particular bacteria actually works. This particular organism is thought to compete with the H. pylori in the stomach and modifies, basically alters how that bacteria is able to attach the lining of the stomach. Lactobacilli is also another organism that it also involved that modifies the immune response and is going to affect the inflammatory process that takes place. Now, our traditional therapy that we tend to utilize for H. pylori generally will eradicate the bacteria somewhere between 85 and 90% of the times. There are variations to that number depending on whether you're using first line or second line. So you may see different figures going from in the low 80s. You may see higher in the 90s if you're using another kind of therapy, but generally this range will hold true. Studies have been done have shown that probiotics, when they're added to traditional antibiotic therapy, definitely decrease the frequency of side effects. So that is something that most persons generally tend to agree on, that adding a probiotic to antibiotic therapy is going to make a patient more compliant because there are going to be less side effects. There are some studies that say that it may possibly reduce the eradication rate. Right? So this particular organism, which was studied at this dose for patients who were taking it for 2 to 4 weeks, was one of the studies that actually showed that there was an improvement in terms of the eradication rate. There are smaller studies that have been done as well that looked at lactobacilli species that have documented decreases in the rate of adverse effect for those patients as well. But the issue is some of these studies are very small. So we can just say for now that it is possible that these things may actually be effective. And in terms of the duration of treatment, there was one study for 2 weeks, and patients have been maintained on these therapies for as long as 3 months. All right. So these two organisms, the Lactobacilli species and friends, have been reasonable evidence to support that when they're added to therapies, added to traditional antibiotic therapy, that there is actually benefit to the patient. It may improve eradication rate. It will definitely decrease side effects, and it will definitely decrease your bacterial load. This is something that has been documented. This is something that has been proven when it is added to therapy. Now, diarrhea is very, very common, and there are many different causes of diarrhea, as you are aware. From infectious causes, it could be related to cancer treatment and various other causes that persons may end up with diarrhea. However, and we know that the mainstay of treatment and how you manage a patient with diarrhea is going to be fluid replacement. You're going to have to be looking at the electrolyte imbalances and being able to manage all of that. We have to be careful though when we're talking about diarrhea, we're talking about our at-risk patients, particularly our infants and our children who are at great risk. We have to be looking out for them as well. Diarrhea is one of the conditions that have been widely studied where probiotics are concerned, and they are thought to definitely alter the intestinal flora in our patients with diarrhea. And some of the best results have been seen in these kinds of patients. A review of over 60 studies was done that had over 8,000 infants and children that showed that probiotics was effective in reducing diarrhea by 25 hours. Does that seem like a lot to somebody? 25 hours? Your diarrhea finished one day earlier? Yes? That's significant to somebody? That would be significant to me, because that means I can go back to work. If it means that my diarrhea is going to be reduced, so instead of going 5 or 6 times for the day, it's going to reduce it to 3 or 2. Is that significant to anybody? All right. So it's not just me that is significant, all right? And there are lots of other studies that were done involving adults and children, looking at the lactobacilli species. And just to tell you that there are other organisms, as you would have heard from your enterogermina presentation, that is not included in my slide, that are actually have been studied and have been proven and have been documented to be effective. But for every study that you find that says that it can be effective, you might find 1 or 2 more that says that there's no statistically significant. No statistical significance, meaning that you can't take it and run with it. Just to put that out there. When you're talking about diarrhea caused by viruses, that's a whole different matter. So that is something that the data right now is very iffy about in terms of, is it really effective for diarrhea that is caused by viruses? That is out the door. Now, we were talking earlier, or at least Doc was talking earlier about C. diff. So there is generally antibiotic-associated diarrhea, but looking particularly at Clostridium difficile, where we know the standard of treatment is our antibiotic therapy, where vancomycin, oral vancomycin is first-line therapy. There is also metronidazole that is also used in the therapy as well. And somebody asked a question earlier about fecal transplantation. I thought it was interesting to I actually included it in the presentation to talk about the fecal microbiota transplantation, which is actually recommended for persons who have had multiple relapses. Just a mere thought of that is not something that I would have wanted to entertain any at all, but the fecal transplantation is something that is actually utilized because the evidence has actually been seen that transplanting the microbiota is actually effective. This is one of the few things that you will actually find as a guideline recommendation. So it's not something somebody is saying. It's actually a guideline recommendation backed up by some amount of evidence. So that's the Infectious Disease Society of America that is now supporting this fact. And just as a nice slide describing all of that, how they would have purified and strained and watered down and chosen different methods of administering administering the therapy to you, which could be via any route, either from the top or from the bottom. Yes, either via the colon or otherwise. Could be a pill, could be through a tube. Different methods actually have been used, right? And it does come with some side effects for some persons in terms of bloating and cramping, but they try to prevent the transmission of disease from patients in that our patients are actually screened. They actually screen the patients whom they're taking the samples from to ensure that they are healthy, so to speak, free from disease and all of that. But with everything you know, there will be risk, right? With everything there will be risk. So we've had a lot of talk about inflammatory bowel disease, but I'm particularly going to mention ulcerative colitis because that's where the strongest evidence comes from. Ulcerative colitis, as you know, consists of, it's a chronic inflammation of the bowels that is plagued with frequent relapses. Patients really suffer quite a bit with this particular condition. It With an overactivated immune response can be affected in terms of the environmental conditions as well as other agents that the patient is exposed to. So corticosteroid therapy along with our aminosalicylates have been considered mainstay of treatment. So we'd have seen our patient on corticosteroid, mesalamine, sulfasalazine, along with other things in order to achieve remission of symptoms and to maintain that remission. There have been quite a number of studies that have been done regarding ulcerative colitis. These are just some of the symptoms that our patients tend to present with. Diarrhea, of course, weight loss, pain, fever, rectal bleeding. It can be quite an undertaking for our patients. Some studies have been done that have actually suggested that probiotics, when used alongside mainstay treatment, actually increases the rate of remission, but it doesn't keep it. So if it's a patient that you want to achieve remission quickly, there are studies that say adding a probiotic will actually help that patient to achieve that rate of remission quicker than if they were just on regular treatment. However, as I said with everything, as you have one study that says yes, you might find one or two others that are going to have something else to say, and those studies may say no as well. So probiotics, of course, have been studied, include species of E. coli and the Saccharomyces species that have shown some benefit or some promise, but there are no official guideline recommendations that are going to say definitively yes. As you talk about Crohn's disease, there are several challenges with Crohn's disease because unlike UC, Crohn's disease runs from the mouth all the way down, and it involves skip lesions, so it may be here, not there, here and not there as you go along, and it is transmural. It is quite extensive. There have been studies that have been done with probiotics and Crohn's disease, but because of some of these challenges, the results have been mixed and the sample sizes have been small. Now, IBS is another matter. Irritable bowel syndrome is one of the conditions that you will find the largest network of probiotics marketing themselves to treat. Because IBS patients tend to suffer from either diarrhea, constipation, a blend of both, or they buzz between both. So we're talking about replacing the microbiota that's going to bring that patient back into balance. And in terms of, because it is a functional disorder that involves altered bowel habits, you find that probiotics have actually found some benefit in that regard. So the overall quality of evidence so far supporting the use of probiotics in IBS has been considered to be weak. But it is suggested, or it has been used, as I said, because it is a functional disorder that has involved diarrhea, constipation, those kinds of symptoms, flatulence and bloating. And administration of probiotics has been suggested and has been used as one of the agents that are considered to be deemed effective in managing some of these symptoms. So there may be benefits for patients with IBS. There are small studies that have been done with constipation and probiotics. Bifidobacterium is another one that has been used, that some studies have suggested that it may, of course, be beneficial because what we are doing is bringing back balance. It may seem a little bit confusing that this same organism that you use to treat diarrhea is the same one that you're going to pick up to use to treat constipation, but remember, we're bringing back balance to an area that has lacked balance. These are some of your products that you will see. Organism by name and strain, because you know we have to name them properly, as well as the dose in terms of how they're available. And this information, if you search, is readily available, and which is where I want us to go to be able to assess and to see how much was the content of the probiotics that we have, so to ensure that when our patients do take it, that they're actually consuming the right amount of probiotics. Now, probiotics have been studied, or we have looked at probiotics for other conditions outside of the things that I've discussed. So probiotics have been used to treat or to manage persons who have lactose intolerance. That mentioned, of course, allergies as well. They have been used in recurrent bladder and ear infections. Probiotics, of course, have been and continue to be used for vaginal disorders, including vaginosis. Oral health is another upcoming area that people are looking at, the role of probiotics in oral health as it relates to prevention of dental caries, as it relates to periodontal diseases, as it relates to halitosis. There is promising information. But the thing with probiotics is that for every 1 or 2 study that you find saying yes, you find something that either says no or says that the information that you're getting may be a little bit inconclusive. But so the question is, where do we go from here? We need more evidence. You don't think so? Same thing Dr. Mills said, not really sure. Maybe, yes. We need more evidence. We need more concrete studies, and of course, we are moving into the era of looking at our probiotics as drugs, right? They're bacteria, but we start to have to treat them as drugs because we have to now get down into the nitty-gritty of who they are. We're also moving into the era of genetical engineering, and yes, even the probiotics too are genetically engineered. Do you know that? That's how we get in our cosmetic probiotics, the things that are custom designed and specifically suited, yes, because we design them specially and we tag them and say this is our trademark, this one is special. So we're going to be seeing a lot more of that. We have to consider the concept of whether probiotics are an unmitigating good. Is it the gift that keeps on giving good? I'd like to hear from the team if you think probiotics are the gift that keeps on giving goodness. Yes? Jury's out? Most times. I like that answer. Most times. Most times. But what do we need? We need more? Do you know that we can provide that evidence from where we are? Do you believe that you can help to provide that evidence? Yes? How many of us follow and track our patients who we recommend probiotics to see how they're doing? Can I see any hands? Anybody follow up? I say yes. I see only one hand. Only one. So when we recommend something to the patients, we don't check back with them to find out how they're doing. Not a probiotic. Even the prescription drug, your patient get the enterogermina on the prescription with the antibiotics. You don't follow up with them how you're doing so that you can say, yes, I have 5 and 6 patients and I followed up with them and they took it and yes, they're doing well. I know this works. Different from somebody telling you on paper that it works. Can I challenge my colleagues in the room that when we recommend things to the patient that we try to follow up with them? If not everyone, every other one, as a start, so that we can have our information that would say, yes. Probiotics. There is research that is being done, quite a bit of research. Some are in the early stages. And of course, lots of research in mice, because we start in mice before they come to us. So there's lots of early research. People are looking at probiotics for phenylketonuria, where there's an issue with the metabolism of the protein, amino acid phenylalanine. Necrotizing enterocolitis is one, and psychobiotics is another matter that is being explored. The same matter of the gut and the brain link is a very, very topical, very new subject that is being discussed in terms of looking at that link between what is happening in your gut and some of the conditions that we don't think are related. So some people are proposing a link between serotonin and dopamine. You wouldn't think of probiotics and the organisms that exist that normally reside predominantly in our intestinal tract, that they have that kind of impact or they have that kind of effect. But that is actually something that is being looked at presently, that there is an effect. So we're looking to our psychobiotics to see what health benefits, mental health benefits, or probiotics may actually be able to confer to us. Of course, we're looking towards new and advancing technology. We're looking towards the use of probiotics in things like agriculture. People are looking towards agriculture to see how it can be applied. There are potential benefits for our diabetic patients, and of course, people are looking at probiotics in terms of cardiovascular disease, right? And cardiovascular disease is a very big topical matter because it is not so much the infectious causes that are killing people nowadays. It is the non-communicable diseases, the cardiovascular disease, the heart failure, the MIs, the strokes. These are the things, the diabetes that has left the person debilitated because they have had to have an amputation. These are the things that are now killing our patients, and we have to be able to make an impact. So, we have a knowledge gap. I like the thinking man. And I say I'm not the only one who like the thinking man. So it's a thinking moment. We have a knowledge gap that we can help to fill. Yes, we need more evidence and we need more research, but there is some data that we do have already, and the vast amount of data suggests great promise in these things called probiotics, to show that the Lord in His wisdom put them there for a reason. So we're just trying to understand that reason why the good Lord in His wisdom put them there, to see how we can replace what we have damaged and help ourselves to be more healthy. There will always be some inherent variations, and that's where we come in order to standardize and to ensure that we're speaking the same language when we are making recommendations to our patients. We are looking for an advancement in technology. And of course, we know with probiotics, there are endless possibilities. So I end by saying there are endless possibilities, but as with anything, I encourage cautious optimism. Thank you. Are there any questions or comments?
Can you hear me? Yeah. I have a comment first and a quick question. My first comment, that was one the other time.
Okay. Yeah. Everybody heard that comment?
No.
He always wondered as a child why the mad people didn't get sick.
Second one.
And now he knows.
But the present is promotion. A serious thing.
Okay, the first part of the question, how widespread is fecal transplantation?
Not very, praise the Lord.
Okay. Another question, is there a arrangement where bank/store in my best of health, I could have my feces stored, so whenever I get sick, I can get my own feces?
I'm not aware of that being available locally, but I'm certain if you go to first world countries, as Doc would have said earlier. Okay. Those fecal banks do exist.
Yeah, very excellent presentation. I enjoyed it a lot. It's a statement that I have to make, and I would like your comment on it. It says that the gut is the pit latrine of the human body. Excuse my terminology. But in so doing, the human body is also in a system of meridian. And there's a connection between the gut and the brain, as you rightfully adhere to. Because in my own experience, sometimes when you're feeling abdominal discomfort, you get the stress factors or the stressors being manifested in probably a headache or some chest complaint or some other disorder, discomfort in the body. So I do agree with you that that particular study or area is one of intrigue and that one that we should be interested in.
Thank you.
Thank you very much, Dr. Michelle Young-Brown. Theo Todd is going to do the honors.
Dr. Brown, we thank you for coming out today and also for giving that inspirational speech and for adding value to our CE at Cari-Med. And on behalf of Cari-Med and the Sanofi team, we would like to say thanks.